Good evening, Bermuda, and welcome to the weekly COVID-19 press conference. Premier, please begin with your remarks.
Thank you, Director, and good evening, Bermuda. I begin by extending my heartfelt condolences on behalf of the government and the people of Bermuda to the two families who experienced great loss over the Bermuda Day weekend. Firstly, to the family of Amber Bridges, who tragically passed away after a serious road accident, and also to the third person we have lost to and also to the family of the 33rd person we have lost to and also to the family of the 33rd person we have lost to and also to the family of the 33rd person. Firstly, to the family of Bridges, who tragically passed away after a serious road traffic accident, and also to the family of the 33rd person we have lost to coronavirus. You're in our thoughts and in our prayers, and we wish you much strength and comfort during this very difficult time. It was saddening to have a weekend of celebration end with the loss of two lives, but it was a harsh reminder of how precious life is and that we must ensure to cherish each moment that we have. Such cherishable moments undoubtedly took place this past weekend as we celebrated our heritage on Bermuda Day. Whether it was along the road supporting the cyclists and runners, at the National Sports Center watching talented local performers, or at home celebrating with family, we showed that we are truly beginning to move beyond the pandemic. In addition to that, we've seen the implementation of SafeKey allow local restaurants to stay one step ahead of the coronavirus restrictions and open for indoor dining. We are making progress, and we are reclaiming our summer as we retake Bermuda from the hold of the pandemic. Moving beyond the pandemic also means getting back to work for the people of Bermuda on issues beyond the coronavirus, including our economic recovery and diversification, and rekindling positive relationships both locally and abroad that have been on hold due to restrictions. I'm speaking to you tonight from Miami, where I'm leading a delegation from the Bermuda Business Development Agency to meet with business and government leaders to build upon the strong economic relationship between Bermuda and Florida, as well as the United States as a whole, and continuing the work to diversify our economy, which is essential for our future economic prosperity. Tonight, I'm joined by the Minister of Health, the Honorable Kim Wilson, who will now provide an update to the country on our latest coronavirus test results, our latest vaccination statistics, and outline the new regulations for our move to phase 3. We're also joined by technical officers who will be able to answer any technical questions that may have, including the Chief Medical Officer. Minister of Health.
Thank you, Premier, and good evening to everyone. The Ministry of Health received 1,226 test results since the last update, and none were positive for coronavirus. This gives us a test positivity rate of 0.0%. Additionally, since the last update, there were 2 recoveries and no deaths. There are currently 17 active cases, of which 16 are under public health monitoring, and 1 is in hospital, and none are in intensive care. Since March 2020, Bermuda has recorded 2,494 total confirmed cases of COVID-19. Out of those, 2,444 persons have recovered, and sadly, there have been 33 COVID-related deaths. The source of all cases is as follows. 305 are imported, 2,174 are classified as local transmission, of which 1,679 are local transmission with a known contact or source, and 495 are local transmission with an unknown contact or source. 15 are under investigation. As investigations proceed, transmission categories may change, and the 7-day average of our real-time reproduction number is 0.27. Bermuda's current WHO country status remains at community transmission. I will now provide an update on our vaccination program. We have completed the 20th full week of vaccinations. Since January 11th, Bermuda has administered a total of 70,731 vaccinations, a figure that rises to 71,847 if you include vaccinations that were administered on Sunday, May 3rd through to Wednesday, June 2nd as well, which is great news. And of the 70,731 vaccinations given as of May 29th, 52% are women and 48% are men. 78.8% of all of our residents over the age of 65 have had at least one vaccination, and 73.6% of those residents over the age of 65 are all fully immunized. To date, 58.3% of the total population has been vaccinated with one dose, and 52.1% of the population has been immunized, namely having had two doses. Our vaccination program is progressing, but we are not there yet, and we need to increase our numbers of immunized residents sooner rather than later. The more people who are immunized, the safer our community will be and the closer to our new normal in terms of how our lives will get. Bermuda will move into phase 3 on its roadmap to recovery on the 6th of June, 2021, with the following changes to the current restrictions. The nighttime curfew will be changed to 12 a.m. to 5 a.m. Recreational boating will be allowed between the hours of 5 a.m. and 11 p.m. and boat occupants are allowed to stay out overnight but must remain on their boat, which must be moored, berthed, or anchored from 11 p.m. to 5 a.m. Boaters must remain on the boat through the nighttime curfew, and raft-ups are not allowed. Commercial boating is allowed and not limited by the group size restrictions. Instead, boat capacity is limited in accordance with the Marine and Ports licensing of the island boats. Large gatherings will have a maximum of 50 people. The Minister of National Security will still have the ability to issue exemptions to the gathering size minimum. Retail businesses and grocery stores can open with no limitations on capacity. Bars, restaurants, nightclubs, and sports or members clubs can open for seated table service and seated bar service indoors and outdoors. Table service is restricted to a maximum of 10 persons per table, and the tables must be spaced 6 feet apart. Seated bar service will be the subject of guidance with respect to distancing as well. Weddings, funerals, and domestic partnerships are allowed for indoor and outdoor ceremonies with a maximum of 50 people. Wakes and receptions are allowed up to a maximum of 50 people, and masks must be worn. Religious services can resume indoors. The maximum gathering size does not apply provided that the public health measures are applied with respect to physical distancing and hand hygiene. In addition, congregations must wear masks at all times. Officiants and choirs must wear masks if unable to maintain 6 feet physical distance. Gyms are open with equipment spaced 6 feet apart. Staff, personal trainers, and patrons must wear masks when not working out and must maintain 6 feet distancing. Outdoor classes are to be maintained again at 6 feet physical distancing. Personal services, barbershops, beauty salons, spas, massage therapists can open and provide services that require face masks to be removed. Staff, however, must continue to wear their mask at all times. Event facilities such as movie theaters, libraries, galleries, etc. can open with a maximum of 50 people. While these relaxations will be welcomed by all, I can and must caution that the key public health measures will still apply. Must wear a mask, keep physical distancing, and practice good hand hygiene. The next close-to-home mobile vaccinations will be at Victor Scott Primary School this Sunday, 6th of June, from 10 a.m. to 2 o'clock p.m. At the close-to-home mobile sites, there will be doctors on site to answer any questions that you may have, and you don't need an appointment. You can just show up and roll up your sleeve. We recommend the close-to-home mobile vaccination program as an ideal opportunity to learn more for those people who want to hear about COVID-19 vaccine from a trusted source. If you need a free ride to any close-to-home mobile vaccine sites, call 533-5903 between the hours of 10 a.m. and 1:30 p.m. Minibuses are available to take you there and to bring you back home. Since the mobile vaccination program began on the 27th of April, a total of 2,665 vaccines have been given as of June 3rd. Approximately 70% of injections were administered to people receiving their very first dose. The Bermuda College Vaccination Center is open Monday to Friday from, from now until the 8th of June from 9 a.m. until 1 o'clock p.m. The Bermuda College Vaccination Center is also holding a Jab and Jam event on Saturday, the 5th of June from 10 a.m. to 6 p.m. There will be music, food, fun, and lots of giveaways. And I encourage anyone who wants to get vaccinated and enjoy the fun to attend this event at the Bermuda College this week, Saturday. The Hospital Vaccination Center is open on Saturday and Sunday, the 5th and 6th of June for walk-ins from 8 a.m. to 6 p.m. and for scheduled appointments from 8 a.m. until 8 o'clock p.m. They will also be open on Monday and Tuesday, the 7th and 8th of June for walk-ins, and scheduled appointments are available from 8 a.m. until 8 p.m. We want to thank the Hamilton Princess and Beach Club, which has provided graciously the use of their property as a location to vaccinate the public. Each person that is vaccinated at this location will receive a $50 gift card from Frontline Foundation. As well, their name will be entered into a raffle draw generously hosted by the Hamilton Princess and Beach Club for a 2-night stay in Fairmont Gold, as well as receive a 50% voucher for the buffet that takes place at the hotel. The hours of operation for this site will be June 3rd and 4th, 2021, from 3 o'clock p.m. to 7 o'clock p.m., located in the Princess Ballroom. The Hamilton Princess will also provide refreshments in the observation area. If you need assistance getting vaccinated or have questions, please contact vaccine@gov.bm or call the hotline at 444-2498 and select option 2. The Vaccine Call Center is available from 8 a.m. until 4 o'clock p.m., Monday to Friday, and Saturdays from 9 a.m. to 3 p.m. And the Vaccine Call Center is closed on Sundays. Bermuda's current supplies of Pfizer, BioNTech, and AstraZeneca vaccines expire on June 30th. The Pfizer vaccine requires 3 weeks between doses. This means that the first dose can be given on June 8th, which is just 5 days away. To be sure that you can receive 2 doses of the Pfizer vaccine, please either register for an appointment at gov.bm or attend the walk-in facility at the Bermuda College, the hospital, or one of our close-to-home locations before the 8th of June. The AstraZeneca vaccine can be administered up to 12 weeks after the first dose. Therefore, the first dose can be given until the 30th of June, with the second dose administered from a new batch of vaccines received from COVAX. As I've said previously, there are enough COVID-19 vaccines available in Bermuda for anyone who wants to be vaccinated. Once the current batches of vaccines have expired, more will be sourced in the coming months. For those who wish to get the Pfizer vaccine, now is definitely the time. There are no guarantees of Bermuda getting more doses in the immediate future. I know that the issue of fertility is an understandable concern, particularly for women of childbearing age. There's currently no evidence to suggest that vaccines, including COVID-19 vaccines, cause fertility problems. Routine pregnancy testing before COVID-19 vaccination is not recommended. However, if you are trying to become pregnant, you do not need to avoid pregnancy after the COVID-19 vaccine. Similar to all vaccines, scientists are studying COVID-19 vaccines carefully and will report findings as they become available. Data shows that any of the currently authorized COVID-19 vaccines can be offered to people who are pregnant or breastfeeding. Pregnant people are at an increased risk for severe illness for COVID-19, which could result in intensive care admissions, mechanical ventilation, or even death. In addition, pregnant people with COVID might be at an increased risk of adverse pregnancy outcomes, such as preterm birth, compared with pregnant women without the COVID-19. Getting vaccinated is a personal choice. So if you have any questions, a conversation with your healthcare provider might help. In closing, I would like to publicly thank the companies and organizations providing support, encouragement, and incentives to our vaccination program. It is an extensive list, and I apologize in advance if I miss mentioning someone. The Hamilton Princess and Beach Club, Red Laser Limited, Aspen Bermuda Limited, Auto Solutions, the Frontline Foundation, Grotto Bay Hotel, Trip Limited, Rosewood Bermuda, Royal Palms, the Fairmont Southampton, Masters Limited, the Lauren at Pink Beach, Cocoa Reef Hotel, the Reefs, Cambridge Beaches, Worldview Travel, AXA XL, Willis Towers Watson, Chubb, Zurich, the Argus Group, Kenny's Kitchen, Marketplace, each of our DJs, aerial corporate charters for the minibus services, taxi drivers, and the multitude of volunteers and location staff for the resources and their time. I sincerely appreciate each and every one of you. Digicel and One Communications for sending out text messages reminding the public about the close-to-home mobile vaccination sites also receive my gratitude. All of the assistance we are getting is truly appreciative. It really is. Many people have done an enormous amount of work to get us where we are today, and a lot of our community has been immunized to stop the spread of the coronavirus. Everyone needs to be congratulated. Bermuda has made significant progress in controlling the spread of the virus. We have had the lowest number of new positive cases in many, many weeks. Bermuda is slowly opening up, but we are not out of the woods completely. We must continue to take personal and shared responsibility in keeping our communities safe as we advance to the next phases. Please remember, each and every one of us must do our part to stop the spread of the coronavirus. It is essential that we follow all of the public health guidelines, as I've stated before. Wear your mask, practice good hand hygiene, maintain physical distancing, and download the We Help Bermuda app. Do the research, talk to your doctor, and make an informed decision about getting the COVID-19 vaccine. Stay safe, Bermuda. And don't forget to avoid the 3 C's: closed spaces, crowded places, and close contact settings. Thank you.
Thank you, Minister, and thank you to your team for all of their continued hard work, especially during our most recent outbreak. Thanks to our collective efforts as a community, we can now move to phase 3, allowing all businesses to open and getting even more of our fellow Bermudians back to work. It is also great to see another day with no new cases. I must echo your sentiments to remind all residents to continue to take precautions so that we can keep this trend of no new cases going. In addition to the move to phase 3, sports have been moved to phase 4, and similar to the approval that has been given for Cup Match for 50% capacity with the use of SafeKey, similar approvals would be given to any large sporting or outdoor event by the Ministry of National Security. If we remain successful in our goal of eliminating local transmission, it is expected that approved percentages may be able to be increased in the future. But at this time, any person or company planning a large outdoor event can be comfortable that they'll be approved for 50% capacity with the use of SafeKey. The purpose of SafeKey in the long term was always to allow for large events to be able to occur while reducing the risk of the coronavirus for those in attendance. In addition to that, SafeKey gave us a way to stay one step ahead of coronavirus restrictions and to allow indoor dining to recommence ahead of our move to phase 3. This gave restaurants the opportunity for more business and to get more people back to work. It has been a pleasure to receive feedback from local businesses on how easy it has been to use SafeKey and how good it has been for them to be able to open their doors completely for some, and for others, once again, to be able to offer their customers a choice as to whether to dine indoors or outdoors in the Bermuda sunshine. While SafeKey will no longer be required for indoor dining as of Sunday, it will continue to be a valuable tool in allowing us to facilitate large events while minimizing risk. Our vaccination program, especially the close-to-home mobile vaccinations, continue to be a success. Thank you to all the doctors, nurses, Bermuda Health Council, and so many others for ensuring the mobile vaccinations run smoothly day in and day out. Thank you to all of those Bermudians who have made the choice to get vaccinated and continue to push us toward our goal of community protection. I also join the minister in thanking the growing number of local businesses and organizations who are supporting our efforts to reach community protection. It is truly a pleasure to see the support and generosity of our business community to help our country continue to progress and to make the pandemic a distant memory. I have often said that we must work together if we are to achieve our goal of moving beyond the pandemic. And through these initiatives, the government is continuing to work to make vaccines accessible to all, and Bermudians are continuing to follow the health guidelines. We are well on our way. Community protection, along with strong protections on our borders, will help to protect us from dangerous variants that continue to emerge around the world. Many would have seen the recent news from Vietnam, where there is a variant that combines the UK and Indian variants that has been discovered. While the Indian variant continues to spread in the UK and is expected to become the dominant variant there if this spread continues. Community protection, along with eliminating local transmission, will also allow us to see the end of all restrictions. In my national address in April, I outlined that should we reach those goals, and in conjunction with strong protections at our borders, we could allow the public health emergency to expire on June 24th. However, there is still work to be done, and tomorrow in the House of Assembly, the Minister of Health will lay a motion to extend the public health emergency by a further 60 days from June 24th. This motion is scheduled to be debated in the House of Assembly on June 18th. It is the government's current plan, if our trajectory of low case numbers are maintained, to keep the phase 3 restrictions that were announced on Tuesday and that come into effect on Sunday in place until June 24th. Following June 24th, at that time, almost all restrictions will fall away, with the exception of restrictions on large groups and the continued requirements for mask wearing in indoor public places. Finally, on the issue of mandatory supervised quarantine, that is now a matter that is before the courts, and therefore the government cannot comment any further. Tomorrow in the House of Assembly, there will be a debate on the government's economic recovery plan. The government has a robust economic recovery plan which covers issues as diverse as the Bermuda Digital Bank, the provision of more affordable housing, and reducing the price of food. I urge all to tune in to learn more about Bermuda's economic recovery plan and listen to the ministers of the government speak about important issues like universal health care and ensuring that we can upgrade the skills of Bermudians for jobs of the future. While we are progressing, we also recognize that there are still difficult issues to tackle as a country and as a government. However, the people of Bermuda can take confidence from this government's continued commitment and success in upholding our promises. One example of a promise kept was the modernization of our labor legislation in Bermuda. On Tuesday, June 1st, new labor laws came into effect, and almost all provisions of the act have broad support amongst organized labor in Bermuda. While there is still a single issue of contention between the government of Bermuda and the Bermuda Industrial Union, it is my hope that this single issue does not overshadow the incredible progress made for workers in this country with the implementation of this new law. As I close, I'd like to announce that following our press conference this evening, we will move to every other week, and our next COVID-19 press conference is scheduled to take place on Tuesday, June 15th. With that, I'm now pleased to take any questions from members of the media.
Premier, we'll now start with Media Maya. Maya Palacio, you are live. Please ask your question.
Good afternoon, everyone. Maya Palacio here for Media Maya. My first question is to the Minister of Health. What vaccine will be available on July 1st?
Sorry. Hi, Maya, as I indicated, the vaccines that we currently have on stock are due to expire on the 30th. We are sourcing more vaccines either through the COVAX facility in particular, and we'll be able to make those available upon their arrival. However, of note is why we're encouraging persons to get the vaccine now, because we have them on island. We don't know when we'll be able to secure further vaccines, notwithstanding the fact that we have already ordered some more from COVAX, but we don't know the arrival date.
Okay. Because that was specifically for students returning in July is why I was asking, because they just wanted to know what vaccine will be available. So they have to kind of put TBD for that. Okay, thank you. My next question is about camps. What is the maximum size for summer camps? Because according to some persons messaging me, the regulation still says only 10 are available for summer camps.
I'm afraid I don't have that information in front of me, but once that has been finalized, it will be on the website, and that communication will be made available to all persons that are administering the camps.
Thank you very much. My next question is about the incentives for the vaccinations currently, like the prizes and gift certificates and things like that. I was just wondering if there was partially like a code of ethics that approved that and how that went to be, because some persons feel that the incentive is just, how is that ethical when it comes to medicine and then incenting gifts to be vaccinated?
Certainly, that's a very valid question. Actually, those incentives are being driven by the community themselves. Community businesses are trying to encourage members of the public to be immunized, and they are the ones that are providing the incentives and providing the gift cards and the like to try to get Bermuda moving and back to business.
Okay, thank you very much. And my final question, even though I believe you answered it during the press conference, Premier, but it is about SafeKey and just the clarity on its use. Will restaurants still be able to actually, let's say, deny people if they don't use their SafeKey after June 6th? Do they still have that right to say no to people for indoor dining, or can persons still just use indoor dining after June 6th without using SafeKey?
Thank you, Maya. Happy to add clarity on that particular issue. Restaurants, it should be stated that it was the law that indoor dining was closed. And it was not expected for indoor dining to open until we moved to phase 3. However, with SafeKey, we were able to amend the law to allow establishments to open their indoor dining with persons with the use of SafeKey. As we move to phase 3, there is not going to be any restriction on indoor dining, indoor bars, etc. So there is no requirement for SafeKey in that particular instance. So the view was to move to phase 3 to eliminate just about all restrictions. We have certainly done that. And so there is not going to be a requirement. So come Sunday, it is going to be free and open to all persons as long as they abide by the public health restrictions. Yes.
Thank you very much. Those are my questions.
Thank you very much. And Premier, we'll now hear from Jonathan Bell from the World Gazette. Jonathan, you are now live. Please ask your questions. Jonathan, you're live. Please ask your questions.
Good afternoon, everyone. Can you hear me?
Yes, we can hear you.
Try again. Can you hear me, folks?
Yes, we can hear you. Please ask your questions.
Afternoon, Jonathan Bell at the Royal Gazette, and thanks so much for having us. Health Minister, good afternoon. Could be one for yourself or maybe your technical officers. We wanted to know as closely as possible, how many Pfizer doses remain in stock that are available for first doses, and ditto at the AstraZeneca, how many of them are in stock for the first doses? Can you tell us?
Yes, Jonathan. With respect to the AstraZeneca, there is approximately 220 doses that remain. And we have indicated, I think I had said previously the statement that I think about 470 had been provided to the Viking crew. Obviously, one of the benefits of having the availability of our vaccinations to allow for our services such as the cruise lines to operate. So they have been provided with that. As you know, they're on Front Street now, and then they will effectively reimburse us with those 470 doses, which allow us for an extended time with respect to the date in which they are expired. And then with respect to Pfizer, we have approximately 5,000 available for first dose, which means we need about 2,500 more people.
Awesome. Okay.
Thank you.
Thanks. Number two, and Mr. Premier, I suspect this is for you. Obviously, Mr. Dennis Pitcher has put a lot of his time for free of charge putting the SafeKey together for us, and we've seen how that's worked. But we wanted to ask, why was the development of the SafeKey program not the subject of a public tender? Would you be able to tell us that?
The development of the SafeKey, I think if it was a public tender, it would have been a little bit more expensive. I think that it's important to recognize that SafeKey is just an adjunct to what the original thing that was being done by the Ministry of Health, and that was to upgrade our vaccination certificates and to upgrade our test certificates. So all of that work was being done, and that work is part of the contracts which have been previously advertised. So I think when we talk about the SafeKey is just an adjunct to that. It was something that we were able to do. And so I think that it's important to recognize the premise of where we started from. This was that people were having issues having their vaccination certificates and test certificates being validated. And my email has had many stories of persons who, had complaints. We also know that people were faking vaccination certificates and test certificates locally. Now they are unable to do that. The same technology, however, that was used for those certificates, publicly verifiable, was able to be used and issued for SafeKey. So it's a minor adjunct, and I'm pleased that we were able to certainly put it in place.
Thanks. Yeah, I got one myself. Mr. Premier, again, you may have heard this. I mean, for the avoidance of doubt, can you tell us, do any government MPs or senators have any sort of financial interest in businesses which receive public funding for the delivery of COVID tests, vaccines, PPE, medical supplies necessary for the administration of tests or vaccines?
I have absolutely no knowledge of that. We certainly have rules inside of this country for the declaration of such interest. Those things are publicly available online, and I do not believe in any way, shape, or form that there is anyone that is certainly benefiting from a public health emergency. There's a significant amount of stuff that needs to be done, and I know that persons will speak about all of the work, energy, and effort which is taking place, but I think it's also important to remember that the vast amount of work that has been done over the last 15 months, we have been able to, test significantly in this country, make sure that we're able to, arrest very large outbreaks. There was a period in time in April where Bermuda's coronavirus statistics were the worst on the entire planet. And that is a scary thought. But the reason why we were able to arrest that was because of the technology that we have, because of what we've been able to deploy, and all of the various aspects around there. But the basic answer to your question is no, I certainly have no interest. The Minister of Health has no interest. I'm sure the Chief Medical Officer, Dr. Miller, has no interest. And if there was any interest, those interests would need to be declared.
Thank you for that. Appreciate it. Last one from me. As you'll know, we didn't make it onto that UK green list. Okay, so several weeks ago, it was stated that Bermuda was unlikely to be added to the UK green list for travel as long as we were classified by the WHO as community transmission. Just hoping to hear what efforts are being made to get us moved to that spread of cases label, and also to get us shifted from do not travel to by the CDC. I guess that's open to all of you. I don't know who to address that to, but those two things with the CDC and the WHO, how do we get there?
Well, let me just give some brief comments and then turn it over to the Chief Medical Officer who can speak to the specifics regarding the international classifications. But I think that I'm certainly disappointed with the news from the UK. Certainly our position with a significantly small number of cases and significant number of days without confirmed cases of local transmission, certainly regarding confirmed unlinked cases and others is certainly disappointing. But what I can say is that we are moving in the right direction. I'm not entirely certain of what the UK criteria is, but what I do know is that the CDC criteria has been spelled out, and it will take a while for that to be upgraded, as you have to be below, I think it's at least falling below maybe 150 cases over a 1 month period. So we still have a little bit of time to get to that point because we're still coming off of the cases which we would have seen in May. But I'll let the Chief Medical Officer address the specifics regarding the revision of Bermuda's country position from community transmission to clusters of cases. It's also important to note that the government would not have been comfortable moving to phase 3 if we thought that there was certainly ongoing transmission that was taking place inside of our community, or the fact if our outbreak was still underway. And the Chief Medical Officer has declared and said that the outbreak is over. And I think that gives us comfort and confidence. I'll let him speak to the specifics of the revision based for the WHO.
Thanks.
Hi, Jonathan.
Hi.
Right, okay. So for WHO, as the Premier mentioned, there are several classifications, and this is a discussion that needs to happen between us, the WHO, through PAHO, and also the Public Health England. So it takes about 2 incubation periods, so that's about 4 weeks of data that is reviewed. Looking at our data at the moment, we are at about just on the cusp of the 3rd week, where we think that our community our country classification should be changing. So we have started the conversations now. Hopefully, we will be once we hit that target, our country classification would move, and it's very similar to the travel health notification for the CDC as well. Their criteria is published, and we are tracking that. We're on the way at the moment, but it takes 28 days before they move us. So that's basically that just lags behind, and we expect that's a matter of time if the numbers continue in this direction to get our country moved down the travel health notification classification. And as the Premier said, the criteria for the United Kingdom isn't published, so you don't know what you need to do to get there.
Well, we're on the cusp of the 3rd week, you said.
For WHO PAHO classification.
Thanks, sir. I think that's me.
Thank you, Jonathan.
Cheers, everyone.
Premier, we'll now go to Trevor Lindsay at TNN. Trevor, you're live. Please ask your questions.
Good evening. I'm not sure if I caught that last part of Jonathan's question, referring to the green list in the UK, the situation with the UK, but I'm going to ask Premier Burt, why hasn't Bermuda made the green list with no new cases in the last 5 days? I'm not sure if you just explained it, but my volume was down low. I caught the very last piece of it. Will the government fight for us to get on this list for individuals trying to return to England, UK presence in Bermuda, trying to reunite with family members? What is it that Bermuda can do to get on that amber list for the UK travelers?
Thank you, Trevor. I think that we are on the amber list, and the question is to move to the green list. So from that perspective, I think what Bermuda needs to do is continue doing what we have been doing. And I think that we're doing a really good job. And I'm so proud of the work that has been done from our health teams, all of our emergency services, the teams at the hospital, and the residents of this country, obeying and adhering by and large the restrictions which have been put in place that have gotten us to a place where we've been able to report multiple consecutive days of no new cases. And as long as that continues, I'm confident that all of these travel health notices will be upgraded, whether they be from the UK or whether they be from the United States. It is unfortunate that we find ourselves here. Part of the question in which you asked is, will the government fight to have that change and address? And certainly we will take that up, and we will hope for revision at the earliest opportunity.
Thank you. Another question, Premier Burt, for you. TNN understands Bermuda Regiment personnel are doing host checks on individuals coming in from the airport with the wrist bracelets. They're asking such questions as to individuals. I got from a family of 4. A lady was and her husband, which was out doing a little exercise and around the yard, and questions as of where's your husband, where are your children? Is this process legal?
I will defer to the Minister of Health, who is a quarantine authority. But I would say that one of the most important things that we need to do is make sure we enforce the regulations that are in place. Minister of Health.
Yeah, thank you, Trevor. I can't comment specifically on the matter that you're referring to. However, I can say that the regiment have been are designed to assist with respect to enforcing the provisions under the Public Health Emergency Order as well as the Quarantine Act. So they have been making random stops to individuals that are on quarantine. It is not unusual for them to perhaps ask questions as to the location of individuals who are meant to be on quarantine. So that what I would anticipate would be part and parcel of their investigative powers to ensure that they know where people are, that the persons that are on quarantine are where they are meant to be.
Thank you. Premier, I heard you mention earlier about the, I'm not sure if it's referring to the quarantine regulations that's going to come into effect on the 6th, and you said that they are in the courts. So is this process going to come into effect? Another part of my question is there is no law requiring you to take the vaccine. So how can you impose and enforce quarantine on those persons to pay for quarantine if they are not breaching any laws?
I'll defer that question to the Minister of Health.
Trevor, I'm sorry, I did get distracted a bit, so I may not have heard the entire question. However, the existing regulations as are the ones that are on the books, and the government is still considering further amendments to the regulations.
So come January the 6th, not January, June the 6th, with the travel quarantine restrictions, are they going to be rolled out?
As I indicated, Trevor, the government is still considering what further refinements will be to the regulations. The status quo as is, as the current regulations state, will remain intact. However, the government is still considering further matters concerning the regulations.
Thank you. My last question. Premier, you're aware the stance taken by the Bermuda Industrial Union against the amendments to the Labor Act. It appears that the government is heading for a showdown. The largest union says that the amendments could see the demise of the Bermuda Industrial Union as we know it. The Bermuda Industrial Union president painted a picture that shows the government effectively dividing and splitting the TUC, the Bermuda Trade Union Congress. President Chris pointed to the government, President Chris's issues is with the government and not at the labor minister. How, Premier, how do you view these allegations being made? B, will the government change the clause that deals with decertification? And C, is the PLP no longer an ally with the philosophy of the labor union?
What I would say is, in answer to the last part of your question, the Progressive Labor Party was born out of the labor movement, and the Progressive Labor Party will govern for all workers in this country and will continue to govern for all workers in this country. And the labor legislation, which was put into place by the government, so there's not a difference in distinction between the government and the Minister of Labor. We act in collective responsibility, and the items which were put in place by the government are supported by the government. There are significant improvements to labor laws, significant improvements for workers that are inside of that act. It is a very large and long act, and we are talking about a disagreement on one particular clause. I do not agree that it will mean the end of the Bermuda Industrial Union. That is not something that I would ever like to see. The Bermuda Industrial Union is responsible for so many improvements and so many issues of lives of workers inside of this country, and that is not it. There have certainly been discussions. Discussions will continue, but I think, as I'd said inside of my statement, is that I would sincerely hope that this one minor issue, or this one issue, small part of the entire bill, does not overshadow all of the progress which has been made in this labor legislation, which has been a long time coming, which has been the culmination of work and efforts of many years between the unions, between employers, between the government, between consecutive ministers of labor to get us to this point. There are significant improvements for workers' rights inside of this, significant ease for the ability to organize inside of workplaces for collective bargaining. And we believe that the advances which have been made, and we stand by the position of the government, but we will continue our discussions with Bermuda Industrial Union, as I think that it is important this one single issue not to overshadow the entirety of this labor legislation, which is a win for workers and a significant advance for workers' rights inside of this country.
So will you change the clause that deals with decertification?
The law that has been passed is the law that is on the books, and the government has made it clear in the putting the place in the law of where the government stands on this issue.
Thank you.
Thank you very much. Premier, we'll now go to Bermuda Broadcasting. Don Burgess, you're live. Please ask your questions.
Good evening. Several Caribbean countries, including Turks and Caicos and Cayman, are requiring or thinking of requiring mandatory vaccine for work permit holders. Are mandatory vaccines like mandatory TB x-rays being given any consideration by the Bermuda government for people coming on work permits as a health precaution?
Minister of Health. To my knowledge, I don't believe that's something that we've considered, but Minister of Health, I'm not sure if you had anything further.
No, Don. You would note that the government's position has always been that we will not require mandatory immunization for anybody. However, insofar as it relates to persons that are on work permit, those discussions have not taken place.
All right, thank you. What's the latest word on changing the MOU with the UK so that 12 to 15-year-olds can take the Pfizer vaccine? And why is it taking so long to get this worked out with only a few days left before they can take their first dose?
We have been in constant discussions with Government House over this issue. I'm satisfied that they too are working. In fact, we had a discussion this morning concerning this, and I am satisfied that they as well are trying to work on our best behalf with respect to allowing for the Pfizer to 12 to 15-year-olds. You can appreciate that not only Bermuda, but there's other OTCs that are also lobbying the UK government who they would have received supplies from and would have no doubt had similar MOUs with respect to the age group. However, unfortunately, it has not moved as quickly as we would like. However, I am definitely satisfied that Government House is doing all they can to liaise on our behalf with respect to this.
The vaccine SafeKeys expire on June 15th. What happens then?
They were put into place for expiration on June 15th as this is a pilot. The view is that they will be reissued for persons, and persons can go and get updated SafeKeys if they need to use them for access to large events that will be taking place.
Okay. And lastly tonight, people are asking about gatherings. Are people able to camp overnight during the curfew? And why can't raft-ups happen as long as they stay at a max of 50 people like other outside groups? And dance schools have put in exemptions for indoor events such as proms and graduations, but we hear there is a serious delay and no one is getting back to them for many weeks. Can you speak on this?
I can speak to a few things of which you have raised, but I think it's most important to say that we are taking a slow and measured approach on this particular issue. Regarding the restrictions. But as I said, inside of March, it is the intention of the government on the 24th of June to lift all remaining restrictions with the exception of large group sizes and the need to continue to wear masks in indoor public spaces. And so I know that there's people who want this to move more quickly, whether it be curfew on other instances. The government, I think it's very important that we take a measured approach. What we don't want to do is to find ourselves going backwards. And so what I would say is I would ask persons to remain from June 24th. Will be in a different space and circumstance, and I'm sure that will allow plenty of time for camping, plenty of time for raft-ups. On the issues of the large group exemptions, that would certainly be a matter for the Minister of National Security. But as I had mentioned inside of my remarks, not only are we advancing the issue for outdoor events, 50% capacity with the use of SafeKey, but we're also putting into place trusted establishments so we can free some of the bureaucracy that surrounds the approval of large group gatherings. But I think one other thing that's going to be important is that a lot of group gatherings that were submitted were for under 50 people. And anything that was for under 50 people that was submitted to the Ministry of National Security will be approved for after the date of June 6th. But we continue to work, and we want to make this process as smooth as possible. And we look forward to continuing the trends of which we're on so that June 24th, the existing restrictions disappear.
If I may, on the raft ups, because I know like a lot of people complained that, you know, it's outdoors, and if they held to the 50 people, why was this not included as part of the exemption so that people could do that?
It's very difficult to enforce on. And so I will ask people to wait until June 24th. I want to raft up too, but we wait until June 24th. We're trying to get to a place where we are not have to be we have to be deliberate. And so I can recognize that there's concerns. If there's one rule that's one way or one rule that's another way, people will always want things to be changed. What we've done is that we've moved recreational boating time back to 11. We've allowed people to stay on their boats overnight. But for those persons who are wanting of raft ups and wanting of camping, etc., it is the expectation who want to stay out past the curfew hour of 12. It is the expectation that if the current trends keep and we continue to see no new cases, that those things will fall away on the 24th of June.
Thank you very much. Thank you, Premier. There are no further questions.
All right, thank you, Madam Director. I want to thank certainly Dr. Miller, the Chief Medical Officer. Hopefully there will be no hospitalizations come 2 weeks. And so Dr. Miller, I certainly want to thank you and the work of which your team at the hospital has been doing. CMO, I'm sure that it's a little bit better and brighter over there in the Office of Chief Medical Officer, where you would have new case meetings every day. But if there are no new cases, certainly that work has fallen away, and we can focus on other issues which are important to the health and well-being of our country. And so, Minister of Health, I want to thank you and your team again for your work and your efforts. I want to remind the country that we do move to phase 3 at 5 a.m. on Sunday, June 6th. And I would ask that we continue to keep in mind the need to continue to follow the 3 C's and continue to make sure that we are taking the necessary precautions so that on June 24th, we can see the end to restrictions in Bermuda. So from Miami, I would like to say thank you, Bermuda, and good night.